Good afternoon, and welcome to our series of webinars focused on bringing you information about COVID-19 related topics. The information in these weekly webinars is geared toward long-term care and skilled nursing facilities, but we encourage everyone who's interested to attend. My name is Kathy Caudill. I'm a communications specialist with Quality Insights. Today's webinar is a live Q&A on enhanced barrier precautions in nursing homes. We will open with pre-submitted questions and frequently asked questions. And if you have a question for our panel, you can submit it using the chat or the Q&A tool in your Zoom menu, or you could raise your hand if you would like to ask your question out loud and request to be unmuted. We invite you to join us every Wednesday for more of our weekly webinars. Next week's topic is navigating opioid use disorder in long-term care facilities. That will be part one of a two-part series on medications for opioid use disorder. So if you're interested in joining us, that will be the same time and place next Wednesday at 2 p.m. And now I'd like to briefly introduce today's panelists. We have several of our quality improvement specialists here today, Deborah Wright, Penny Imes, and Shirley Sullivan. And we are also joined by our medical director here at Quality Insights, Dr. Jean Storm. And Jean will kick us off with a quick review of enhanced barrier precautions.
Hi, everyone, and thank you for joining us again. We're talking about enhanced barrier precautions again. I know there's been a ton of questions and some confusion and some misunderstanding. So hopefully we can help you clear that up today. I'm just going to be going through a brief overview of our previous education on enhanced barrier precautions. MDROs, we know that they are multi-drug resistant organisms. They're resistant to one or more classes of antibiotics. They're frequently resistant to common antibiotics like penicillin. And MDRO infections are severe, so they're associated with increased costs if a resident is admitted to the hospital and increased mortality. And we know that MDROs have increased dramatically over the last few decades, most likely because of frequent use of antibiotics. We're hitting these bacteria with a lot of antibiotics, which then helps them develop resistance. What is the difference between colonization and an acute infection? Colonization means that a bacterial pathogen is present in or on an individual's body. That means you might get a urinalysis and the urine culture shows the presence of a bacteria, but the individual doesn't show any signs of infection. They don't have any symptoms and they don't have a fever. So that typically means that the resident is colonized with that bacteria and is not acutely infected. Colonization does increase risk for infection. So a resident might have, say, MRSA in their nares, and that's going to increase their risk of developing a MRSA infection somewhere in or on their body. And individuals we know who are chronically ill, immunosuppressed, if an individual has recently been in the ICU, they are at increased risk of developing an infection from bacteria that they are colonized with. So when we think about enhanced barrier precaution implementation, that is the use of gown and gloves during high contact resident care activities that are going to provide opportunities for the transfer of MDROs from staff hands and clothing. I use the same example, when you are rolling a resident towards you to change the resident, to clean the resident, and you roll that resident towards you and the resident kind of comes up against your clothing, that is transferring MDROs, if the resident has an MDRO and is colonized with MDRO, to your clothing. And then you might go to the next room and do the same thing with the next resident, or do another high contact care activity. And then you're transferring that MDRO that's on your clothing to the next resident. So that's why we use a gown for enhanced barrier precautions, to protect our clothing from the transfer, and our hands as well. The MDROs may be directly transferred from resident to resident during these high contact care activities through staff. And nursing home residents with wounds and indwelling medical devices are at high risk of acquisition and colonization with MDROs. So It's indicated the use of gown and gloves for high contact resident care activities is indicated when contact precautions do not otherwise apply. So this is for nursing home residents with wounds and indwelling medical devices, regardless of MDRO colonization, as well as for residents with MDRO colonization colonized with a targeted CDC targeted MDRO. And we're going to be looking at a tool which is going to make it very easy for you to figure out if the resident needs enhanced barrier precautions. We're going to be looking at that tool that we have at the end of this presentation. Examples of high contact resident care activities which will require gown and glove for enhanced barrier precautions include dressing, bathing, showering, transferring, providing hygiene like brushing teeth and combing hair, changing briefs or assisting with toileting, changing of linen. So if housekeeping is changing linen in the resident room, and then device care, central line, urinary catheter, feeding tube, or wound care. So all of these high contact care activities are essentially being performed in the resident room. We've had some questions about care activities, high contact care activities outside the resident room, like PT and OT, and we're going to be addressing those again at the end of the presentation. But essentially, these are high contact care activities that are being done in the resident's room. Physical and occupational therapy, though, as we'll address at the end, maybe in the resident room or also in the therapy gym, and then enhanced barrier precautions should be utilized. Chronic wounds, the intent of enhanced barrier precaution is to focus on residents with a higher risk of acquiring an MDRO over a prolonged period of time. So this includes residents with chronic wounds, and we're not talking about shorter lasting wounds such as skin breaks or skin tears that can be covered with a bandage. We're talking about pressure ulcers, diabetic foot ulcers, unhealed surgical wounds, chronic venous stasis ulcers. When we talk about indwelling medical devices, we're talking about central vascular lines, dialysis catheters, urinary catheters, feeding tubes. When you are giving medications via those feeding tubes, you want to make sure that you are using enhanced barrier precautions. Tracheostomy tubes, any kind of care with trachs, you should be using enhanced barrier precautions. So these are some signs that you can utilize. They're able to be downloaded from the CDC website that you can utilize to remind staff to be utilizing enhanced barrier precautions. So these signs are intended to signal to individuals entering the room to the specific actions that they should take to protect themselves and utilize enhanced barrier precautions for the resident. The sign must contain information about the type of precautions and the recommended PPE to be worn for the resident. Generic signs are not adequate, just to say, instruct an individual to speak to the nurse. And a sign should never include information about the resident's diagnosis or the presence of a resistant MDRO. Signs do not need to include that information at all. And obviously, we're not going to include a diagnosis. These are some resources that we have available. I'm going to say the CDC website is key. They have multiple frequently asked questions. They will give you different scenarios. Very, very helpful. I would encourage you to visit that website. If you want to talk through the CDC guidance, please feel free to reach out. And I'm going to stop my screen sharing now, and I'm going to let Deb share her screen. Is Deb there?
Yes, I am. I'm just working
Okay.
on sharing it the way that Kathy told me to.
I was like, where did everybody go?
Nope, I'm here. Sorry. Okay, I think I did it.
Yes, we can see it.
Okay. So we did get some questions submitted since our last webinar, either via the survey that our communications team sent out or directly to some of us. So we're going to let Kathy ask those questions. Some of us have done some research and we're going to talk about those answers. But I just want to point out that this resource that was mainly created from West Virginia Healthcare Association, they adopted it from Virginia Department of Health and Human Services. It is a fantastic resource. Everything, almost, I won't say everything, almost everything you need can be found in this document. Everything is linked right to the CDC, like Dr. Storm was saying. So if you have questions like what is a targeted MDRO, you can click on this link and it takes you right to that. A lot of the questions that we are getting, you can find, sorry for scrolling, but if you go down here to the frequently asked question document, CDC's frequently asked question, almost all the questions that we are getting are truly answered in this document. So that's where I say this particular document, I would have readily available as you are working on implementing, and if you have any questions related to enhanced barrier precautions. So Kathy, I will let you start with the first one.
All right. Thank you, Deb. And so I'll pull up our first question here. One of our pre-submitted questions. It says, if a housekeeper is going into a room and having no resident contact and not touching linens, does the housekeeper have to wear EBP PPE?
Okay, so this answer is not an easy one, and it's probably not going to answer this person's question exactly the way that they intended, because they didn't really say what the housekeeper was going in the room to do. So I looked at the CDC frequently asked question related to housekeeping, and it said, should environmental services or housekeeping personnel wear gowns and gloves when cleaning and disinfecting rooms of residents on enhanced barrier precautions? Now, I know the question originally was, they're not touching linens, but if they are going in to clean and disinfect, and here's what they said. They said that the research was the basis for the current guidance, evaluated high contact resident care activities, not specifically the risk of transmission of MDROs to the hands or clothing of EVS or housekeeping personnel. They did address that changing linen is considered a high contact resident care activity, and gowns and gloves should be worn by EVS. However, when you get into the cleaning, they said you have to follow your facility's policy and what is the risk of exposure to bodily fluids, chemicals, contaminated surfaces while you're doing that cleaning. So are you just going in to mop the floor? Then maybe your policy is you don't have. But if you're going in to terminally clean the room and it was a room that was on enhanced barrier precautions, then maybe you would. But that all needs to be addressed in your facility policy.
Right,
and I think Kathy was going to drop the link in the chat for that frequently asked question, but it will also be on this resource as well at the end, like I showed you.
Thank you, Deb. Our next, and I did put that link in the chat along with links to the presentation slides that Dr. Storm showed and how to download this flow chart that's on your screen. Our next question is physical or occupational therapy considered a high contact resident care activity?
So this is a question we are getting a lot, and we all have our own interpretation, our own feelings, our own beliefs on this particular topic. But at the end of the day, per the frequently asked question, the answer was yes. Therapists should use gowns and gloves when working with residents on enhanced barrier precautions in the therapy gym or in their room if they anticipate close physical contact while assisting with transfers, mobility, or any other high contact activity. They also went on to state that in addition to the standard precautions, to make sure that you are cleaning reusable therapy equipment. And I think we've all gotten pretty good with that since COVID. Maybe not prior to COVID, we had, we would have cleaning schedules, but not necessarily after each use all the time. But I think we have clearly moved in the right direction with that since COVID, of cleaning that reusable therapy equipment after each use. But unfortunately, we know, we hear your frustrations when it comes to resident rights, resident dignity, having all this PPE on in the therapy gym, but it is high physical contact activity. And even though you're not in the resident's room, you're in the therapy gym, they are saying that yes, therapists should have gowns and gloves on if they are working with somebody that's on enhanced barrier precautions.
Thank you, Deb. And someone also asked this same question in our Q&A. So to that person, if you have any follow-up questions, let us know. I think you mostly covered what they were asking. Our next question is, do we need to use EBP when caring for a colostomy?
So this is, again, another question that we've been receiving a lot from a number of you. And while we were struggling to find the answer, this is where this group, even though these weekly webinars are open to almost everybody in the state of Pennsylvania and West Virginia, we do have a lot of times the same people attending week after week. And it was good to see that following a lot of those questions after our last webinar, one of you actually sent us the answer. And then we researched it, we found it, and Kathy's going to put the link again in the chat. But they found it on a CDC video from November 2022 when they started talking about enhanced barrier precautions. The person who submitted it actually put the time on the video of where they answered the question. And the answer was that they are not included in enhanced barrier precautions. So just the physical presence of a colostomy is not enough to put them in enhanced barrier precautions per the CDC video. And it was at, the video was 59 minutes and it was right around the 53-minute mark of that video. It was actually during the Q&A session of that video. So thank you to the person that shared that information. And I think that's really great with what this group can do is, you collaborate with each other and we share information. So thank you for sharing that.
Thank you, Deb. And yes, I put that video in the chat. Next question is, what if there are no residents with MDROs in the building? Do residents with indwelling devices still have to be on enhanced barrier precautions?
Hi, Kathy, this is Shirley. I can take this. This is a great question. And the answer would be yes. Anyone with a wound or indwelling medical device should be on enhanced barrier precautions, whether or not there are known MDROs in your facility or not. And the reason being, studies have shown that nursing home residents may be colonized with an MDRO and you may not know it. So even if you don't think you have a resident with an MDRO, you may. So yes, you would need to use enhanced barrier precautions for anyone with an indwelling medical device or a wound.
Thank you, Shirley.
You're welcome.
And this is our last question from our pre-submitted and frequently asked questions that we've received. So everyone here, if you have a question you want us to address, please go ahead and put that in the chat or the Q&A. So our last question is more of a scenario. It says there's a resident with a wound on the heel/foot on enhanced precautions per the CDC guidelines. There's no drainage, but there is still dressing on, and the resident is able to participate in all activities. Do you still require the precaution sign on the door with supplies at the door?
I'll take this one too, Kathy. So pressure ulcers are included on the list of wounds per the CDC for enhanced barrier precautions. So even if the resident is up and about, you would still use enhanced barrier precautions for any high contact resident care activities, which mostly would happen in the resident's room. So you would definitely need to place a sign at the door to alert the staff of this and then have the supplies nearby.
All right, thank you, Shirley. And let's see, it looks like we have a question in the Q&A, so I'll go ahead and read that. It says, when completing the MDS, would you consider the resident as being in isolations if they have EBP in place if one colonized?
So I can look up the actual guidance for the MDS, but it can clearly tell you the answer is no, that you would not code that, because there's a list of criteria that you have to meet in order to code the MDS for that isolation, and this would not meet that definition. But if that person needs further guidance on that, I can share that RAI section with them.
All right, thank you, Deb. And that's the last of the questions that we've received from today's audience. So I'm going to run over some closing notes, and everyone here, if you have a question you'd like us to address, please submit it using the chat or the Q&A, or you can raise your hand if you'd like to request to ask your question out loud. And while we wait, I'd like to, as I said, I'll run over a few closing items. I'd again like to invite everyone to next week's webinar, which will be on navigating opioid use disorder in long-term care facilities. It will be next Wednesday at 2 p.m. We also invite you to bring your questions to our virtual live chats every Tuesday and Thursday. One of our quality improvement specialists will be there to answer your questions on topics like enhanced barrier precautions, or we could also talk about quality improvement initiatives, infection control, or MDS coding. You can find the links to our live chats and webinars in the newsletter we send out every Friday called the Last Minute Lowdown. If you don't think you're on the mailing list to receive that newsletter, you can contact me at caudill@qualityinsights.org, and I will get you on that list. And I will drop my email in the chat in just a moment as I look to see if we have any more questions. It looks like we do have a couple in the Q&A. Okay, so the person who asked the PT questions that I said earlier, I wasn't sure if we totally covered it, but they do have a follow-up question. So I'll read the original question. It said, can we clarify PT gym and hallways? This has been a hot topic at our facility.
So yeah, so the gym is considered the same as the resident room. So if a resident is on enhanced barrier precaution and you're doing high contact area with the resident in the therapy gym, such as assisting with mobility and high contact areas, then yes, you would have to follow enhanced barrier precautions. I'm just going to take some of these next ones going down here, Kathy. So how would you address a resident who is self-consent, not wanting signage posted on their door? I think that's a very tricky one. And honestly, I would reach out to your Department of Health field office, or if you're in West Virginia, the OFLAC office, and ask them, because while they may not want the sign, you still have to protect your staff and people entering that room. So I think that definitely needs to go to your Department of Health for further assistance on that.
I would agree with you, Deb, and also reach out to your ombudsman, to come in and speak with the resident if that's needed.
Yep, absolutely. Any possibility we can point out a resource that will clarify the difference between verbiage of colonized versus history of?
I'll say, I don't know if this really matters. So if you read the CDC FAQs, if that resident has any history of a CDC targeted MDRO, CDC says it does not matter if you test and you get a negative result. It's directly in the FAQs. Like they say, once you utilize enhanced barrier precautions for a CDC targeted MDRO, then that resident is on enhanced barrier precautions for the duration of their stay. So we're talking about the CDC targeted MDROs.
And
go ahead.
I see in the chat, someone actually asked their Department of Health earlier today in regards to the signage and refusal of the signage. And they were told, per CMS, residents and families cannot refuse certain practices that are to protect the health and safety of staff or other residents. Therefore, they cannot refuse. I would encourage education with the POA to explain what enhanced barrier precautions is required by CMS of all nursing home and rationale for its use. And then guided them to the letter from CDC regarding nursing home and patient families, which is in the chat. So thank you, Taylor, for sharing that. I appreciate that. So Kathy, that post only came to us. If you could post, can you repost that so that everybody can see that?
Oh, yes, I can. Thank you for that response, Taylor.
I don't know if that,
As far as PT hallway versus the gym, I think we're getting into semantics with that. You certainly aren't going to start treating everybody in the hallway just to get around not having to wear a gown and gloves in the therapy gym. So I think you need to look at the activity that is being performed. And if it is involving mobility, high contact, exercise with them, you would have to follow enhanced barrier precautions. It's not going to matter if you're in the room, in the therapy gym, or in the hallway. You still have to have the enhanced barrier precautions.
Thank you, Deb.
I will.
I wanted to read one that was in the chat for a little bit. It says, should the beautician and the beauty shop wear PPE when cutting a resident's hair?
the CDC does not directly address this question. I would probably reach out to your Department of Health, because it's not, I did not see a correct question. You know, they say, specifically saying common areas, that EBP does not need to be worn. So like the dining room, EBP does not need to be worn. So does, you know, the beautician is not really performing, you know, direct care activities. But I think if there's any question, I would reach out to your Department of Health just for clarification, because, you know, they're the ones that are going to be giving the citations. So I think it would be, if anything is controversial, it is worth reaching out to OFLAC or the Department of Health, because then their surveyors are getting the education as well. And those are the surveyors that are going to be in your building, making sure you're doing everything right.
Thank you, Dr. Storm. And we only have time for one or two more questions. So if we don't get to your question today, we'd ask that you try to contact, please contact either your quality improvement and specialist here at Quality Insights, or your local Department of Health.
And actually, all these questions that are left, Kathy, one is one that we've been talking about, and the other are almost all the same. So jumping down to Judy's question, residents are walked in the hallway for distance and obstacle negotiation. That would, in my opinion, would be a high contact area, because it is still one of the therapy examples that they gave was high contact activities such as mobility. And so if you are assisting to walk someone in the hallway, that's mobility. So I would say yes. There are a lot of questions about MRSA or ESBL being a targeted MDRO. So I am going to bring up the enhanced barrier risk assessment again. And if you click on the CDC, and I did that the wrong way that my Kathy told me not to do. Let me try this again. Okay. So if you do this, you click on the CDC targeted MDRO list. And it gives you the list of MDROs targeted by CDC. And it says there's also additional important MDROs, as somebody asked, but not limited to. So, you know, MRSA, ESBL, they are on this list. So I would say that, yes, they are targeted MDROs, but like Dr. Storm said earlier, anything that you're in question for, reach out to your local Department of Health.
Thank you, Deb. Were there any other questions in the Q&A that you wanted to address?
Does the signage have to be outside the room, or can it be posted inside the room with a symbol on the door alerting staff? That is going to be your policy. That would be whatever your policy is. The only thing I would say in regards to a symbol on the outside of the door, you just need to make sure that the symbol is directing them to what you're putting in the room. So just make sure that the symbol is understood by anybody that would be going in that room. So we thank you for all of your questions. We know there are still multiple questions out there regarding this topic. Reach out to us. We will try to guide you in the right direction. We don't have any additional insight other than what we can find on CDC, just like you're looking at. So we can guide you to those resources. But I highly recommend the resource that we shared today, that you have that available, put it on your desktop so that you can click on all those links whenever you have a unique facility question.
All right, thank you, Deb. And thanks to all of our panelists today and for everybody for your good questions. As we said, if your question did not get answered, or if you did not ask a question today, please reach out to your quality improvement specialist. If you don't know who your quality improvement specialist is, you can email me and I can put you in touch. And of course, you could always contact your local Department of Health. And I'm going to go ahead and wrap us up since that's all the time that we have today for questions. Before we sign off, I'd like to ask everybody here, if you could please answer a short evaluation after today's webinar. It is anonymous and will show as a pop-up as soon as the webinar ends. So if you have a couple minutes to fill that out, we would appreciate it. I'd like to thank all of our panelists for joining us today, and I'd like to thank all of you for joining us and hope to see you again soon.